And we now talk to Health Undersecretary Leopoldo Vega. Good morning, sir. Thank you for taking our call.
Good morning, Trina, and good morning to all the listeners of CNN.
Now, Yusek, you said the healthcare utilization rate in Metro Manila is still at low-risk status. What exactly does this mean? And are you saying that hospitals are not as overwhelmed as they were when we saw the surge earlier this year?
Yeah, that's right. Compared with the months of April and May, we do have a decrease in the health capacity utilization rate. This is really a measure of how the hospitals are doing in terms of the COVID-19 patients. Now, HCUR in Metro Manila is now in the low-risk position, meaning that all the beds are taken together in all cities of Manila. They have collectively been shown to have a lower health utilization rate compared with the last 2 months.
Okay, but for the hospitals that are reporting full capacity, who is occupying their beds? Is that necessarily COVID patients or patients who require other treatments?
Yeah, there are hospitals, and these are the level 1 and the level 2 hospitals, and mostly level 1 hospitals really within the certain cities in Manila. They do have high risk position, especially for the intensive care units. And that's very understandable because it's very hard for a level 1 or a level 2 to allocate more critical beds, especially they would need resources such as the equipment and, of course, the human resource. So that remains to be still on the high-risk position, but definitely Metro Manila taken as a whole, since most of the cities are borderless and they can actually refer patients to the different bigger level 3 hospitals, both public and private, then that could easily be managed in terms of proper coordination and the referral system.
Well, that's certainly good news for Metro Manila, but we also understand that cases in the regions continue to rise. Could you tell us what is the situation for hospitals and isolation facilities?
Pia, I'm losing you.
All right, can you hear me now, Yusek?
Yes, right.
Okay.
Right.
All
Sorry.
right. No problem. So I was saying that is good news for Metro Manila. However, in the Visayas and Mindanao, we are seeing a rise in cases. How would you describe the situation of hospitals and isolation facilities in those areas?
Well, we've noticed also an increase in the number of the HCUR. I mean, the rate, especially still in Region 2, but it's gradually increasing, but more in the Visayas and Mindanao, and even in Puerto Princesa in Palawan. We've noticed that there has been a steadily gradual increase of the healthcare capacity and together with intensive care utilization. And that's very true for Western Visayas, Iloilo, and also on Negros Oriental, Dumaguete, and the Caraga region in northern Mindanao, and Cagayan de Oro in the western Mindanao, Zamboanga and southern Mindanao, which is actually the Davao region. And we've noticed this trend. And then one of the things that is really a limiting factor in some of the provinces is how they can easily cope up with the critical cases, because most of the number of the ICUs in those provinces are still very limited and very low. And so we have adjusted, we have actually coordinated with the different chiefs of hospitals, especially with the level 3 retained hospitals, the government, since they have the resources and since they have actually the human capacity to increase the critical care beds. They should allocate more, and they're trying to do that. That's one of the strategies that are easy to take, would be to increase the utilization or increase the allocation for the critical beds in those areas which have the capacity to easily expand to serving critical care patients. And that's what we're doing. And second is we're also putting in a human resource coming from positions, coming from the DOH Metro Manila. And they can do actually an emergency hiring if they need human resource, especially in the institutions that they're in, whether it's going to be public and private, where the DOH will be very supportive of this. And third, of course, is we're trying also to deploy again some of those healthcare workers in the low-risk areas to assume positions or actually go or voluntarily go to areas that are high risk, especially in Mindanao and Visayas. And we're slowly doing this together with equipping some of these provincial hospitals or regional centers in Mindanao, in Western Visayas, providing them more ventilators, BiPAP machines, and even high-flow nasal catheters.
Right. So, Yusek, at the rate that cases are increasing in the Visayas and Mindanao, can you estimate by when the hospitals will be full or become overwhelmed?
But in the all of the some of the hospitals, not all, but they're in the moderate risk and the high risk category, and there are also 1 to 2 cities with critical risk positions. And the only way that we can actually accommodate the number of COVID-19 critical cases for these hospitals is that they must be able to expand this at once together with the private and the public. And we are assuming that if we can actually control and escalate the community quarantine to a more stricter level of community quarantine, then that would mean probably it would lessen down the number of new cases or the number of infection and probably not overwhelm the hospital capacity. But we are also looking into the direction that as we move along with vaccination, we have to scale it up, because I think this is one of the only way that we can actually protect the community, aside, of course, from the very aggressive implementation of our minimum public health standards and the prevention and treat and isolate, trace and test kind of strategy that has to be done.
All right. Thank you so much for your time this morning, Health Undersecretary Leopoldo Vega.